All right. Well, welcome everyone. Happy Wednesday and Happy New Year. Welcome back. Hope everyone had an enjoyable holiday season and hopefully a restful one and have returned recharged and already back to doing all of the great work here in Prince George's. So for our introduction today, for those joining us this afternoon, if you would like to introduce yourself with your name, your organization, and then our mindful minute, the first one of 2025, is what are you looking forward to accomplishing in 2025? And I can kick us off. For those who I have not met yet, my name is Taylor Palmer, and I am with the Prince George's County Health Department. I help manage our local health improvement coalition here in Prince George's County. So, with the BHAG, we also have three other work groups, and then I am also situated in the Office of Assessment and Planning in the Health Department. So, I help out with strategic planning, the community health assessment, the community health improvement plan. And so that is also tied to one of my goals in 2025, that the health department will have a completed health assessment come the summer. So looking forward to that and all of the hard work that it will take, but hopefully be a good guiding document for us to move everything forward.
Hello, everyone. I'm Talicia Islar, and I'm with Synergy Family Services. This is my first meeting, and I am the Chief Program Officer there, and my responsibilities are in line with just the growth and expansion of the agency. And I also manage our case management program, therapy program, and outreach and marketing. So what I look forward to the most is probably just expanding our community partnerships for Synergy, just joining more groups like this and just getting more in touch with the community.
Thank you so much for joining us and welcome. And I see a few comments here in the chat. Doriana is finishing her dissertation. Congratulations. And Brittany says expanding new opportunities to enhance and expand programs she's overseeing.
I'm sorry I'm a little late, Taylor. Are we doing introductions?
Yes, we are. Welcome, Dr. Blunt.
Hi, how are you? Happy New Year.
Happy New Year. Is there anything you're looking forward to in 2025, Dr. Blunt?
Yes, plenty of things. Hi, all. My name is Dr. Shatia Blunt. I am the owner of I Am Me, LLC, a social enterprise dedicated to elevating Black minds through mental health, through culturally appropriate psychotherapy services, and helping to diversify and strengthen the workforce in this pipeline. I've been a part of this group, I guess, for maybe a year now. I am looking forward to expanding my practice. I am currently hiring for therapists who want to be entrepreneurs and own their own private practice. I am launching a book in March around social work and supervision. And I am engaged in some policy advocacy around annual behavioral health visits. So all of those things are happening in Q1 of this year. Thank you. Nice to meet you all.
Thank you, Dr. Blunt. You reminded me I probably should have restricted that question just to Q1 for all of our busy thinkers and all of the great folks who are doing so much great work. Glad to hear everything that's happening. And I can't fathom that it's been already a year since you last presented to the BHAG. It really just feels like it was just yesterday.
Yeah, the presentation was less than a year, but in terms of coming to these meetings and being a part of the discussion, it's been about a year, I think. Yeah.
Thank you very much. Anyone else would like to introduce themselves?
Hi everyone. Happy New Year. I'm Joanne Oport with Africans for Mental Health. This is my first meeting here. I serve on the Suicide Prevention and Awareness Work Group for Prince George's County. Just looking to see what you guys are doing since this is the first meeting, and I'm also looking forward to the warm weather. I came from Texas a couple of days ago, so just want some warmth. Thank you.
Absolutely. Thank you for that, Joanne. Anyone else?
Good afternoon. My name is
Hi.
Carmen Rivera. Thank you. Carmen Rivera with the State's Attorney's Office. I remember I joined your meeting a while ago, and then things get busy from time to time, but I'm glad to be back. I'm looking forward to the new year and hoping to get some information and advice about the fentanyl, programs that we may have and how we can help our youth in our schools who are in tremendous need of this type of support. Thank you.
Carmen.
Thank you.
And folks, as you are making your introductions, feel free to also, if you feel comfortable with it, put your preferred method of communication. So if you prefer to be reached by email, I'll make sure that our directories are updated with your information, and then also share that with any contacts for any meetings that will happen after this meeting. So do feel free to do that. Any other introductions this afternoon? All righty. Well, oh, I see Winnie's hand. Sorry to miss you.
Oh, that's okay. I just logged on. My name is Winnie Moore. I'm Chief Programs Officer at iMind Behavioral Health. What else I was supposed to say?
Oh, something that you were looking forward to accomplishing in the new year.
Something I'm looking forward to accomplish in the new, we're looking forward to accomplish is finding a new location for our offices.
Well, do keep us updated. We'll certainly show up for that welcoming party and wish you all the good luck finding a new location.
Thank you. Thank you.
All right. Well, thank you everyone for your warm introductions and sharing all of your goals. Again, wishing you all the luck, and please do let us know how we can support you along your journey in Q1 and the rest of 2025. Today, for our agenda, we have a presentation from the Suicide Prevention Coalition. We'll hear from Sharice Smith on some of their coalition updates, and hopefully be able to build some more coordination across Prince George's County and be able to map out all of the great work that is happening in all of our groups, our work groups, and our coalitions. Then we will have some time at the end to discuss some administrative updates, get some feedback from you all about planning for the new year, who we want to hear from, and the direction that we want to go in as a work group. And then, as always, we will end with our community announcements and upcoming meetings. So without further ado, we are joined today by Sharice Smith from the local Behavioral Health Authority. Thank you so much for joining us this afternoon, Sharice. Really looking forward to your presentation on the Suicide Prevention Coalition's great work. And I will go ahead and stop sharing my screen and let you share.
All right. Thank you, Taylor, for this opportunity and the BHAG team. My name is Sharice Smith, and I will let me see if it's not sharing. Okay, I'm going to share my screen. Good afternoon again, everyone. Let's see if I can get this started. You know, I never did this with a double screen. So let's see if we can. I should have practiced. Okay, so I don't know if you, okay, that's not presentation mode. So I don't know what you all see and what I see. So
we can see your first slide. Do you want to test advancing the slide and see if it advances for us? Okay, yes.
Okay, I didn't know you, okay. So we'll do it in this view. I see all my slides at the bottom and I don't know what you all see. But anyway, my name is Sheree Smith. I am the Public Health Program Chief for the local Behavioral Health Authority. And all that means is that I oversee some of the program operations here within the LBHA. And I'm responsible for some of the planning that happens within our division for the public behavioral health system and community behavioral health programs. Today, I want to talk about not the LBHA, but the Suicide Prevention and Awareness Coalition. That coalition, and some of you all are actually on the call today, so thank you, some of the members. So thank you for joining us today. I want to just give a brief overview of the coalition. I'll take you through how it was established, and then we'll talk about partnerships and just answer any questions that you may have towards the end. And this is not the correct presentation. Taylor, I'm going to ask for your assistance to share the presentation I emailed to you, because the screen, I can tell from what's on the screen, it's not the correct thing. So I apologize if you all can bear with me. And it's probably because I have 90 screens open on my computer. So Taylor, I appreciate you assisting.
Absolutely.
Okay. Thank you so much, Taylor. All right, we can go to the next slide. So the Suicide Prevention and Awareness Coalition's purpose is, the purpose was to establish the Prince George's County Coalition. There are coalitions in several other jurisdictions in Maryland. We're all charged with working with county stakeholders and other community partners and those who have shared interests to promote resilience and to raise awareness about suicide prevention through outreach, education, and prevention activities. Some of the activities of the coalition include implementing the Suicide Prevention Strategic Plan, which we're charged with actually developing, promoting evidence-based behavioral health care and wellness, so sharing information on evidence-based training, programs, and opportunities, and actually identifying any evidence-based programming and opportunities that Prince George's County may benefit from. Utilizing data-informed actions to educate, guide, and engage stakeholders, health providers, and the public. So there's a need for shared data and information regarding suicide prevention, and we're aware of that. So this committee will help share the information to our stakeholders and the public and other providers. Ensuring availability of culturally appropriate messaging addressing racial, age, language, and gender disparities, and increasing access to resources, care, and support for individuals impacted by suicide. Thank you. So why did we establish this Suicide Prevention and Awareness Coalition? I put a little notation up there that the LBHA and for Prince George's County ensures a range of prevention, intervention, and post-vention behavioral health services. We identify the gaps in the behavioral continuum and then seek resources to fill those gaps. While doing so, we came up with a gap of behavioral services, and the gap was there was no one talking about suicide prevention on a broader scale. So we knew that that's something that we needed to have as one of our charges. And these are the things we identified. There was data supporting a need. There was a lack of public awareness. There was a lack of knowledge of resources. And then there weren't that many training opportunities available. And we'll talk a little bit about some of those training opportunities that are available. And so we got with our Office of Assessment and Planning within the Health Department, we were notified of some of the data points that we can use in order to help guide the work. And so we found out that there's the suicide mortality in the county was similar to this state by gender, with males being 5 times more likely to commit suicide compared to females. We found out that the Hispanic residents at a lower suicide rate compared to the county population. We found out that the percentage of suicides for Black non-Hispanic residents for Prince George's County was lower and comprised of 39% of all suicides compared to 30% for the state. We identified veterans as a population where the national it was lower than the national suicide rate at 33.9 per 100,000. Sorry for the typo, 100,000 veterans. But in 2021, out of all the suicide deaths, 18% were veterans. And then their youth suicide plans and attempts were increasing for middle and high school students. So the LBHA developed this internal work group, and we set out to just start up some of the work, start brainstorming, start looking at the data, start looking at who was needed to be around the table, what we thought, and then we would open it up to those other individuals that became the coalition so that we can get all of their feedback and establish some of the things that we're talking about today. And one of the things that I wanted to share with you all are our goals and objectives. And our goals and objectives were developed from the Governor's Commission on Suicide Prevention. So we reviewed that document. We kept Prince George's County in mind, thinking of what needs we had in the county. And then we extracted some of those goals that will address some of the needs of the county. And then we presented it to the Suicide Prevention and Awareness Coalition. Getting a little bit ahead of myself, but that's how we came up with these goals and objectives that we're going to, that's here for us today. So I'll read our goals and then you can take a look at the objectives. The goals are to integrate and coordinate suicide prevention activities across multiple community partners. Goal 2 is to develop, implement, and monitor effective activities that promote wellness and prevent suicide and related behaviors. Goal 3 is to promote suicide prevention as a core component of health services. Promote the adoption of zero suicides as the aspirational goal within all community support systems. And then Goal 4 was to increase the timeliness and usefulness of surveillance systems relevant to suicide prevention and improve the ability to collect, analyze, and use this information for action. And I'm not going to read the objectives for you all, but we can go to the next slide, Taylor. Don't want to sit there and read to you, but I know Taylor can share these with you all. So we established work groups from the coalition. The membership that we identified, we did a survey. We asked the coalition membership, what work groups would you be interested in, that whether it was tied to a personal interest or professional interest. And some of our coalition members assigned themselves to work groups. This was done in our last meeting that just took place last month. So the work groups include, they're tied to a few things. As you can see in Goal 1, that focuses on community awareness and education. That would include a suicide prevention and awareness campaign. I'm the staff support, the LBHA staff support that's tied to the group. And then Goal 2 was community engagement, training, and outreach. Sade Campbell and Ayana Brown are the LBHA staff support tied to that committee, that work group. And that includes limiting lethal means access. So, and then Goal 3 is community access. And Eugenia Greenhood, who's a part of the BHAG work group, is the staff lead on that work group. And then it includes evidence-based practices and interventions. And then goal 4 is data and research. And Deborah Collier, who's also, I know, a member of the BHAG, and Amani Booker Lewis, who is the LBHA manager. They're the staff support to that goal, and it includes the best available data and research. Now, just wanted to show you a little bit about the key steps as, I guess, a guide of where we're following, so it can show you where we're trying to go. So I just put this little graphic here to let you know that, share with you that the ultimate goal is to develop a strategic plan. Right. So we've done several things. We convened the internal work group that I shared with you all. We established roles. We established a purpose. We reviewed preliminary data. We secured a grant to offer training and awareness campaigns. We gathered relevant stakeholders, pertinent stakeholders. We established an ongoing channel for communication with them. And then we continue to continuously promote relevant training. We review data to guide our work, and we continue to review data for that purpose. And then we establish goals and key objectives that I just shared with you. And we, of course, I mentioned that we surveyed the members of the coalition for their input. And lastly, and most recently, we established those work groups that I just reviewed with you. Excellent. All right, so some of the current active membership, we have a long membership list, but some members, of course, within the coalition are more active than others. And I just wanted to point out some of the partnerships as I'm presenting to the BHAG work group, because I know many of you have a hand in some of this, some of the behavioral health work in the county, and serve some of the population. So if you see members that aren't regularly attending, or you have suggestions, you can throw them in the chat. I will speak a little bit about some of the members who are invited that attend periodically, but we would like to have consistent attendance. So, of course, we have our partners with the Behavioral Health Administration, Office of Suicide Prevention, and those partners, we're also a part, the LBHA is also a part of the state coalition as well. And so membership from the state coalition also attends the local jurisdictions coalition meetings. And then we have representation from the Department of Corrections, the Health Department Behavioral Health Services, Behavioral Health Division, Assessment of Planning and Prevention. They also have frequent and active representation. And then we have Prince George's County Police Department, Veteran Affairs, Prince George's County Public Schools, Department of Social Services, our 988 provider, Community Crisis Services, Inc., Africans for Mental Health, and I see Joanne's on the call today, very active member. Great seeing you, Joanne. We have representation from our mobile response team, which is iMind Behavioral Health, Department of Family Services Agency, Area Agency on Aging is what that should say. And then Department of Family Services Local Management Board, also known as the Children, Youth, and Families Division. And then NAMI. And so as you can see, you'll see a few gaps there in the representation. You will see that we don't have our faith-based partners. We don't have, we have a couple of local providers because they are connected to a lot of our crisis work and our suicide prevention work. But you don't see a lot of local providers. And you'll see we don't have individuals with lived experience. So there's some gaps in there. So again, if you see some gaps in this membership, you have ideas, throw them in the chat and I'll take them back to our work group. But we are looking to ensure that that we increase the active membership. I neglected to say at the beginning of this presentation that we are 4 meetings in our coalition. So it's a brand new coalition for Prince George's County. It's the first, but it's brand new. There are other jurisdictions that may have been doing this for a little while longer than we have, but we're definitely looking for additional active and consistent membership to help move our charge forward. All right, I just want to show you a little bit about what the commitment looks like. So of course, we're asking everyone to be active. We're asking all of the coalition members to, at the very least, attend the 6 meetings per year. Our meetings run on I think it's the third Thursday. Every other month. And they're about an hour and a half. As you can see, an hour and a half, a lot of work gets done during that time. And then we ask that that members participate in a work group based on their professional and personal interests. You can also participate in more than one work group, but we definitely value the coalition members' input. So so participating in the separate work groups allows their input to be brought into action, because the work groups are the work group members are the ones that are going to put all of this work into action. And then we're asking to participate in some training activities as they are able to. So we share a lot of the training, suicide prevention training on just knowledge of LGBTQ resources and services. I'll share some of those trainings with you a little bit later, but those trainings we thought are vital. If we're going to be talking about this work and putting it into action, we thought that we, as coalition members, should at least have the very basics, right? What language is appropriate to use when we're speaking of suicide and things of that nature. And then we're asking all members to participate in the strategic planning activity. Like I said, at the end of all of this, we should have a strategic plan developed for Prince George's County. And then take action to challenge stigma, raise awareness, and promote suicide prevention in their environments, their work, their home, and their community. Thank you, Tyler. All righty. So when we speak about the Suicide Prevention Awareness Coalition, while that coalition was based on invitation, we always know with the work that we do, that there's room for partnership and collaboration. I'm gonna. I see a little error on this, so I will pull up my notes. So we are asking that, I know I asked if you all had any suggestions to the membership to drop it in the chat, but also if you have anyone, or you know of anyone with lived experience that may want to participate in the coalition, we are seeking someone with lived experience. We reached out to a few people and we have not been successful. So that's one area that some of you all on the call may be able to assist us with by making recommendations. And also, we look forward to partnerships on identified projects and community events. So as coalition members, our contact will be in here. If there are events that you all are having that we can collaborate on, if there's a project that you're working on in your organization or in your volunteer work or your community, then you can contact us and we can see how we're able to collaborate there as well. And then for sharing of resources and information, we often have a lot of training and information to share, and we share it with our internal coalition and then our provider resource list. But there may be opportunities that the BHAG members will benefit from. So, and vice versa, right? There may be some opportunities that you are made aware of in your workplace or your community. And you're like, the Suicide Prevention Coalition will be great to participate in this opportunity. I definitely want you all to keep us in mind, and moving forward, we'll keep BHAG in mind as well. And then and the last bullet should really read that we'll um, need help distributing the suicide prevention toolkit. Now, I will share that link with you all, but the Office of Suicide Prevention within the Behavioral Health Administration, they have established this elaborate list of resources in their link tree, and they also have a toolkit that's available. And the toolkit includes a good thing I'm going to talk about that the next slide. I'll let you know a little bit about what the toolkit consists of during the next slide. All right, so I put the link here for the Governor's Commission on Suicide Prevention, which helped the membership, the coalition establish our goals, objectives, and break out to our work groups. And we also have the BHA Office of Suicide Prevention Reference Guide. Now, we shared this with many of you all I know, and we keep sharing it because if you take a look at the Maryland Action Plan to Prevent Suicide in Schools, there is an array of information, trainings, just resources. It's a very comprehensive, well thought out, put together plan guide. And so I encourage you all, and it's not just for, it says schools, but if you look at it, these are resources and information that you can use in the work that you do with all ages. So I encourage you to take a look at that. And then the Office of Suicide Prevention website, like I said, has links to trainings and other information. So if you go to the link tree, you'll see pretty much everything there. And then I put the Scoop newsletter on there. I think I hope I put the latest one. But the Suicide Prevention, Office of Suicide Prevention for the Behavioral Health Administration. They also have a monthly newsletter called the Scoop that they send out. And we tend to share that with everyone as soon as we receive it. That's on our listserv. And again, that has more recent information, trainings, even policy. They'll put in their newsletter, and that helps to guide some of the work that we do on the local level as well. And then they have the information for the 988 Suicide and Crisis Lifeline. And they have the 988 toolkit that's always included, and I've included it here for everyone. I know you've seen it a few times, but we like to always mention our 988 partner, our 988 program, our 988 Suicide and Crisis Lifeline, just so that we can keep that 988 number at the forefront of our minds and those resources there, just like we keep 911. Yep, so I think that was it. All right, and so here's our contact information. This is our number to the local behavioral health authority, our main line. You can reach us, and that's PGC_LBHA. And I included our website URL and also our work group members. So if you know any one of the work group members, it doesn't have to be me, and you have those opportunities for partnership that you identified, or you have just a bright idea around suicide prevention and awareness, we are here. We look forward to feedback. We look forward to additional collaborations and partnerships as we get this coalition off the ground. So thank you. And I guess I should open it up for questions, Taylor. Is that okay?
Absolutely. Thank you, Sharice.
Okay. Yep. So I will, at this point, if there are any questions regarding the coalition, myself or any member of the coalition can take this time to ask us anything you may have.
Oh, yes. Hi, I'm Larry App from Shepherd Pratt. I have a question. I actually serve on the Montgomery County Suicide Prevention Coalition, so it was really a pleasure to hear all the wonderful things you guys are doing. I just wondered, do you, I find one of the problems with this issue and advocating for it is we really don't have like a unified way in our jurisdictions to measure all the spectrum of suicidal behavior. So, like, I feel like we underreport it. The police collect data, fire rescue,
Mhm.
or emergency rooms, or
Sure.
crisis
Certainly.
centers, and
Mhm.
this data is never aggregated in often. And I just wonder if Prince George's County has, gotten over that obstacle. Is your data unified so you can really have a sense of suicidal behavior going up or down? I mean, I'm just sort of struggling with, as a basic
Absolutely.
thing, our data and being able to use
Yeah.
it to advocate it effectively.
Yeah. So Larry, I will be totally honest with you. I lean on Deborah Collier, our senior epidemiologist in our committee, to answer those data questions, and she could not be with us today.
It
So
just hopped on.
You did? Okay. So you know what? You heard. All right, Larry, meet Deborah. No, I'm just kidding. Deborah, did you hear the question regarding the data?
I did hear the question, but I guess I just wanted to make sure I understood. So when you say unify, what do you mean? I guess if you can better define that.
Well, I mean, like some people, presented as completed suicides, and maybe they'll see, like in a jurisdiction, maybe 6 to 32 completed suicides, and then they'll say, well, this problem doesn't seem so large, but the real extent of it is you might have had like 2,000 emergency room visits for suicidal ideation, emergency petitions, welfare checks by the police and fire rescue, visits to, mental health clinics, and it's never really collected together so that people can see, the full impact of suicide. And I was just wondering, like, if anyone has ever tried to kind of unify all those numbers so that you can really see what's going on. I hope that makes sense. I'm
It does. It
sorry.
makes a lot of sense. And I think to your point, I think most local health departments, in terms of like data analysts or epidemiologists, I think we do try to tell a comprehensive story. So to your point, it's not necessarily people that have completed suicide, right? It's a hospitalizations, it's like you said, the emergency petition. So it's a number of different things that tell a complete story. So I think from our perspective, and I'm not sure what Sharice shared in terms of data, but I think we do try to look at, like hospitalizations. We look at intentional, so there's the intentional self-harm injuries that are typically what you would see like from hospital visits and things like that. So we do look at those different types of data sources to kind of give a complete picture of what's happening and to kind of better define what's happening, and, even in regards to like our youth. So some of those things we can see like in their behavior, like if they're being bullied at school, if we're seeing, a lot of, forced violence in schools and things like that. Those are behaviors that can indicate, people that may be at risk for suicide. So I think at this point, I think that's happening more in terms of
Mhm.
just, providing data that looks more comprehensive at kind of what's going on, and also looking at like not necessarily just completed suicides in terms of like manners of death or mechanisms of death, but also looking at um, um, kind of what the behaviors that kind of lead to, or the risk factors that kind of lead to that. So I think that's happening more and more the more that people, kind of look at things in kind of a quantitative matter. I think now the idea is that we kind of know that we have an issue, and people are starting to look kind of at the whys of why these things are happening. And I think you'll see more of that.
Okay, thank you, Larry, for your question. I appreciate it. Um, I see a question in the chat. Sylvia says, does Prince George's County have a crisis center? Um, yes. So related to suicide prevention specifically, no, but we have a behavioral health crisis stabilization center that just opened in September. And the providers are and the center is called the Dyer Care Center. But it's for adults only 18 and over. It's a 24/7 center that provides an alternative to emergency department drop-offs. And I can grab some information and throw it in the chat if that's the type of center that you were referring to, Sylvia. If not, you can come off and mute if you want. and ask your question, but I'll drop the information for RI Dire Care Center in the chat. And they do take emergency petitions if that is a question that will come up. Let's see. I was just checking the chat briefly. Gina said we actually have a crisis stabilization center for adults. So she already answered it. So thank you, Gina. You're on it. And if I will still put the information in the chat soon, so you will have the contact information for the Dire Care Center. And
I see Joanne's hand.
okay, thank you, Joanne.
I might be wrong in my assertion here, but I'm just going back to Ray's comment in terms of like working together. I serve on the behavioral health council. I serve on there's a high utility users for Prince George's County that looks at all of these issues, and I'm also now serving on the coalition for suicide. I think the synergy here is looking for like that universal group, and I'm really going back to bolster Sharice's request so that we can all be part of the same team and, so to speak, just be able to participate in this work group and be more effective with our time and efficient with our time. Just looking at groups I have to be a part of and the numerous conversations that come up about suicide prevention and attempted suicide, and issues people are experiencing who are on the receiving side in terms of like addressing crisis, and the caregiver side in terms of like how do we navigate the space for our loved ones, and for the patient side in terms of like, okay, there's a crisis stabilization, what's the step down after that, what if I need to be admitted in a mental health hospital, for example, just to get work on my mental health, but not really because I need substance use disorder services. And so just going to support my friend here since she is my friend, and all come and join us on board so we can address what Larry raised, because the numbers are always different everywhere, and there's so many meetings we're all a part of, and we could be missing something in the link just simply because there's a devolution of the work, and we're all trying the same end, right, is to break the stigma and make sure that these services are available and there's no duplication of effort. So and just as a pitch to all of you, or as a shout out to all of you, Africans for Mental Health has been offering mental health first aid training and suicide prevention training. We partnered up with Shepherd Pratt through Larry, and also with the Department of Health doing youth mental health first aid. And we'll be training our second cohort this month. It's interesting to see who's signing up for the training. So we have caregivers who've signed up, but we also have people who work in the state and county agencies who really want to learn what it looks like to be a part and parcel of this allyship work. So our colleagues in there saying like, yes, we service customers in different aspects, and we're looking for ways we can better serve them, and business owners are also looking at ways they can better serve their clientele who are coming into their businesses, who might be experiencing a mental illness crisis, and just looking at how 988 has been rolling out. But for our community, which I speak on behalf of the immigrant African community, it's just a challenge, right? So there's so much stigma, but ways that we can empower. And so if you're looking for ways to for mental health, please join the coalition. again, but I just appreciate being a part of this space, and thank you so much for the invitation.
Oh, you're absolutely welcome. Thank you, Joanne. I appreciate how you always support the behavioral health efforts in the county overall. And I think it's very important that you're on, hopefully we're not spreading you too thin, but that you are a member of your organization is a part of these conversations. So appreciate that. Any other questions? Anything in the chat that I missed?
Reese, I have a quick question.
Okay.
I'm curious, a part of the Governor's Commission and this being a requirement for all of our Maryland jurisdictions, I'm curious if there have been learning opportunities as we look at looking on this slide here. some of these populations of focus in Prince George's County that we know need the most attention when it comes to suicide prevention and um, um, those secondary and tertiary intervention pieces. Has there been collaboration? Is the state helping to facilitate collaboration between jurisdictions? So looking at our Prince George's County partners, partnering with maybe Larry's group in Montgomery or Howard County partners.
So yes, so the state has established regional coalition meetings. I guess I should have mentioned that too. We have the state coalition and then we have regional coalitions where Prince George's County is able to meet with Montgomery County, and the regions change. So I think Frederick is in that region, and I can't remember the fourth jurisdiction right now. I'm in several regional meetings, and sometimes the regions change. So you'll have Anne Arundel in a meeting with us, and then sometimes you'll have someone like further south, like Charles County. But I do know that Montgomery County is in, and Frederick, and if Gina can remember, I'm not sure what other county, but Frederick and Montgomery are in those meetings with us. So they do allow for time where we can collaborate as a region. And then, of course, we have the state meeting where further collaboration can occur.
And are you finding that the coalitions, their efforts are aligning, in terms of the educational piece? Are any folks working on advocacy pieces, or is there anything that you've seen in other jurisdictions that Prince George's that the coalition is taking a look at and maybe considering in the new year?
Yeah, I actually hear that a lot of where we want to go, because these are the regions, the membership that's in the region that we're in, actually are further along in their coalition. So a lot of what we are proposing in our charge, they have already started doing. And then there's some jurisdictions that have not started at all. So we're all at various stages. But yes, there's oftentimes and I wish I could remember our last meeting, because there were some suggestions about lethal means. There were some suggestions about working with not survivors of suicide, because we don't say that. I learned that in the training, so that's why these trainings are important. But they're relatives. So what's the terminology I'm looking for, Gina? Right now. There's an area where we haven't. I'm sorry. You say something, Gina?
No, I can't remember, Sharice.
You can't
I'm
remember?
just
Okay.
blank like you are.
Yeah, and I wish I was prepared for that question, Teller, because I made a list during our last meeting of things that to bring back to the coalition that we did not address. And just from hearing from other regions, like, oh, we didn't even think about this. And they've done the same. They, when we went through what our some of our next steps are, they're like, oh, the work groups. Like, there's some jurisdictions, they just have the one coalition, right? And it's open invitation. There's no work group focus activities. There's no even goal to do a strategic plan for their jurisdiction. So I just find it useful. But there are areas, Taylor, I just can't think of specific ones right now offhand.
Well, and I would say, Sharice, that I think a lot of this will be dictated for us through data. What is the data for Prince George's County showing? Like an example would be the increase in the number of suicides by firearms.
Yes.
So, that's saying to us, hey, that's an area we don't even address. Maybe we need to start looking at doing some community outreach events, trainings around harm reduction.
Yeah, thank you, Gina. Yeah, we're definitely allowing the data to help guide our actions as we move forward through this coalition. Yeah.
Thank you for that. And if there are ever any opportunities for regional support that the BHAG can support in, please do keep us informed as well.
Absolutely. And I'll be dropping some trainings in the chat. There some trainings from the Trevor Project that I think what is their care training. I know that they have coming up, and their ally trainings. So just take a look at that information and see if it's something that interests you. I know I learned a lot about um, just the LGBTQ population from taking these trainings, different terminology to use, what's acceptable in different communities and what's totally unacceptable, and biases, right? Things that you didn't even know that you have. Some of the trainings really brought some of those things forward so that you can address them as an individual as you move along in your behavioral health work. So I definitely will be sharing. I'll drop a few of those in the chat with you all today. But I'm sure that if you go to that, the link tree for their state Office of Suicide Prevention, that information will be in there.
Got it. Thank you very much. Any additional questions? Joanne, I think I saw your hand up earlier. Did I miss you?
No, I forgot to drop it. Sorry.
Any additional questions for Charisse, or any ideas for any upcoming community events that you'd like to put on the calendar, put in front of Charisse, or any organizations, or I'll include Charisse's information here in the chat and in our meeting notes if you have any individuals, again, taking a look at those list of priority populations, if there are folks who have lived experience who belong to those groups, or who have lived experience in Prince George's County, please do send the information Charisse's way ahead of the next meeting is in February, I'm assuming. Okay. Any other questions?
I just wanted to, this is Dr. Blunt, let me turn my camera on. I've been listening in and thinking about just the concept of suicide prevention, and understand that oftentimes practitioners like myself are not in private practice, that are in private practice may not be as involved in the conversation. And so, and in thinking about the folks that I serve, like I'm not in the public behavioral health space, and many of my clients who experience suicidal ideation are responding to workplace pressure, financial issues, chronic pain, etc. And so I'm wondering if there's some opportunities. I know that there's an emphasis on data, which is quite important. And I know that the data that comes out around suicide is oftentimes quantitative in nature. And so I'm wondering if there's some opportunities to speak to the coalition or anybody about just some of these qualitative stories, or to tell stories, if and not necessarily the lived experiences of those who may have had attempts to die by suicide, but from those of us who are actively working with folk who never make it to the hospital, because we do a lot of the prevention in the therapeutic space. So if there's ever an opportunity to share generally just kind of the stories, so that we can begin to think about prevention from an organizational context, like how does our community, from a community well-being standpoint, how does our geographical space and the spaces in which we live, play, and work often contribute to suicidal ideation. And so I think that's an important part of the conversation that may be missing from the prevention space, and even in some of the focus areas that I saw from the slide, which I know from the quantitative statistics. So I just want to offer that. I think us as therapists can be a really great resource, because we collect stories all day, you know what I mean? And we have a very intimate understanding of the multifaceted pieces that that contribute to a person wanting to die. And just to be very honest, sometimes it makes sense given the pressures one feel, and we're not intervening sometimes, I think, in the proper spaces.
Yeah.
Oftentimes when we really want to think about maybe some primary prevention campaigns, as opposed to secondary and tertiary efforts. So that I'll pause with that, and just wanted to, put that in the space for consideration.
Definitely, thank you. And I will say that hasn't even come up in any of the conversations with all of the people that's involved, is having that qualitative feedback, right? And it's just, and that's very important for us to hear some of those stories, because like the data guides the work, but also the what's really happening in real time actually helps guide the work. Data can be a few years back, but the qualitative stories is telling us what's happening now and giving us an idea and another perspective. So I think you said Dr. Blunt. I wrote your name down because if we need to reach out soon, I'll definitely bring this back to our work group. And then maybe, we can make that a part of our agenda, just, having a period of time where, you just give us your perspective. If you have partners or someone
Yeah, I'll
else,
be happy to gather just a list of, a few of my therapist friends who, we're working heavily in the prevention space. Luckily, many of our clients don't make it to the hospital because we are doing a lot of the upfront work, and we can see the symptoms even before the client understands that that's on the trajectory. So I do think, I could, get a few of us together, and we can come and just talk, we can inform some of the prevention efforts from a space, from our lens.
Okay, that sounds great.
Hello.
Yes.
Hi, this is Carmen again. I was going to ask a favor, maybe if there is a way that we can start working maybe with the Board of Education on controlling more of the school's behavior on the youth. There is a lot of going on social media. Some of the kids, they get into fights, and by purpose of uploading information in social media, it's like there is a contest of whose school will have more fights. And also the fact that some kids bring to the schools fentanyl and grab other kids and purposely uh, force them to introduce the pills or the little whatever it's called on other children, and they do it all together just to start forcing them to use it. And it would be great that maybe there is some type of commitment for, to put more education, more watching, and that it has to be a partnership on all, the police department, the Department of Education, the state's attorney's office, and of course behavioral. You know, that's it.
Thank you for that, Carmen. I hear that educational piece, and you maybe utilizing social media just as our youth utilize social media, the coalition and members using social media for the reverse effect, right? Educating and letting them know that some of those things that they're posting on social media, with the impact, maybe like showing them through social media ourselves. So that may be a good idea, but that's a great suggestion.
Yeah, but not only to the students, but also to the principal, the staff members, to learn how to control, because they may have only one person there. And sometimes when fights go along, they don't know how to handle it. And then, kids are afraid to speak up because they fear repercussions
Yeah.
and from the other kids and also the parents. I have had complaints of parents that are afraid to speak because they even tell them in the school that they're becoming a nuisance,
Yeah.
and because they
Yeah.
are trying to speak up. So we have to start getting a way that we can get something organized where, you
Mm.
know, there has to be some type of help from the behavioral, from the health department, from, that we start going to the schools and doing some more advocacy. And for that matter, speaking with the principal and the administrative assistants and there is another issue going on is that the kids come to school and then they get out of the school from the back of the school, or the in order to really be out all day doing stuff with fentanyl, and then when the school is about to close they come in again, and they have their own friends opening the doors for them. But there has to be some more control. It's not just the police. The police can do so much, but it's that we really tackle the situation from the mental health perspective.
Yeah. Thank you, Carmen. Okay. I'm not seeing any more questions. So I'll turn it back over to you, Taylor. Thank you, everyone, for allowing me this opportunity to share the information and to develop additional partnerships with the BHAG work group. I appreciate you all today.
Thank you, Charisse.
You're welcome.
Hope to certainly connect with you soon and hope you all have a wonderful meeting in February. Again, keep us updated with any training opportunities that you may all locate, and we will promise to do the same thing. We will have those bidirectional communication channels open.
Absolutely. Thank you.
Thank you.
And I'm going to jump into our community announcements. So first, we have the Prince George's Health Action Coalition Partner Survey. So our PGHAC Partner Survey is open through January 31st. If folks can commit a few minutes to taking the survey, it will ask about your organizational information, ask a few questions about populations served, the services provided. We hope to build a stronger partner database, and I know this work group has been especially interested in mapping out a behavioral health continuum of care here in Prince George's County, and so we'll be able to use that information moving forward to identify gaps and make sure that we are reaching folks who should be at the table for these monthly meetings and who we should be hearing from to fill the known gaps that we have here. So if folks can please complete that survey, I will include it in our meeting notes, and I've included the link in the chat. Is there anything anyone would like to share in terms of community announcements, any upcoming events, or any requests for the BHAG?
I would say that I am working on with Senator Augustine's office once again on another policy addressing, in my opinion, the behavioral health provider shortage, whereas currently provisionally therapists are not allowed to work in private practices and also bill Medicaid. They can only work in community behavioral health settings. And so that, for me and others, I'm sure is a huge barrier because it kind of limits the workforce pipeline for provisionally licensed therapists. It also challenges sometimes the type of training they could get when toward their full licensure, and also it limits the amount of clients that can be serviced by private practitioners that are not in the public space. And so once I get more, I had a couple of meetings and we're doing some kind of research to determine how viable policy would such policy would be, but already got some support from the NASW in Maryland. And so it's not fully baked at this moment, but probably next meeting, I'll have some updates and maybe some opportunities to ask for support in policy in that area.
Thank you, Dr. Blunt.
You're welcome.
Any other announcements or any organizational updates? All right, well, thank you everyone for joining this afternoon. We will reconvene on Wednesday, February 19th at our usual time. But of course, if you need anything in the meantime, please do feel to reach out. I've put some contact information here in the chat, but I will be sure to include this information in our meeting notes. But thank you all again and have a wonderful rest of your day.
Thanks, everyone. Have a